Welcome to Everyday Nursing Knowledge Lectures, and today we will learn how to assess Glasgow Coma Scale or GCS. Glasgow Coma Scale is used to assess a patient's LOC, that is level of consciousness. That is how alert and responsive a patient is either to environment, that is surroundings, or to stimuli. The stimuli can be two types. It can be verbal, that is to speech or voice, or it can be to a painful stimuli. Now, when do you apply painful stimuli? That is, if the patient is not obeying commands or in the absence of any spontaneous movement, you apply pain to the patient and you see the patients respond. There are two types of painful stimuli. One is peripheral painful stimuli and central painful stimuli. In peripheral painful stimuli, you apply pain to the peripheries, that is to extremities, and you see spinal cord response. In central stimuli, you apply pain to the center of the body, and here you see the brain response. Peripheral stimuli you can assess by applying pain or pressure to the fingernail bud, whereas central stimuli by trapezius squeeze, supraorbital pressure, and sternal rub. Now, fingernail bud pressure, you apply pressure or pain to the fingernail bud by using a flat pen or pencil, and you will see patients respond. You have to remember, this is not a brain response, this is spinal cord response. So initially, to see the patients respond, you may have to do a central painful stimuli, and if the patient has no response, you can do a peripheral stimuli in all four extremities and see the extremity movement. Now, the central stimuli involves trapezius squeeze, supraorbital pressure, and sternal rub. Trapezius squeeze, you are squeezing trapezius muscle. This trapezius muscle extends from back of the neck to the shoulder, and you have to squeeze this muscle by using your index and two fingers for about 1 to 2 inches, and you see the patients respond. Now, supraorbital pressure, you apply pressure to the supraorbital region, that is above the eye socket and below the forehead and below the eyebrows. In sternal rub, you rub the sternum, but remember, sternal rub can often cause bruising. So you apply these painful stimuli and see patient's response, and here you are assessing the brain response. Now, in Glasgow Coma Scale, you assess 3 responses: patient eye opening, patient's verbal response, and motor response. For eye opening, you can give a maximum of 4 score, for verbal 5, and for motor 6. So total of 15 score in Glasgow Coma Scale. And if the score less than 15, let's say 30, that means patient has a mild brain injury. If the Glasgow Coma Scale score is between 9 to 12, that means patient has a moderate brain injury. If the score is less than 8, 3 to 8, that indicates patient has a severe brain injury. Now let's see how to assess the Glasgow Coma Scale in detail. Now, you walk into the room and patient has spontaneous eye opening. Patient opens his eyes. Then you will give a score of 4 for eye opening. Whereas you have to speak to the patient or to the voice or to sound if patient opens his eyes. Then you give a score of 3. If the patient opens his eyes only to pain, you can do a peripheral painful stimuli. You can apply pressure to the nail bud, and if to the pain only the patient opens his eyes, then you can give a score of 2. If the patient does not have any eye opening, if the patient doesn't open his eyes even to painful stimuli, no eye opening, you give a score of 1. Now coming to verbal response, you give a score of 5 if the patient is oriented. Now to assess for orientation, you have to ask few questions. That is patient's name and date of birth. You are assessing whether the patient is oriented to self. You can ask what time is it, or what month or what year is it, the place where the patient is at right now, or what situation, what brings him to the hospital. If the patient answers all these questions correctly, then you will give a score of 5. If the patient answers this question incorrectly, let's say if you ask what year is it and patient says wrong answer, you can say patient is confused and you give a score of 4. If you ask these questions and if the patient doesn't answer these questions, instead randomly say some words or sentence. Example, you ask patient's name or what year is it, and here the patient is saying after lunch. So here the speech is inappropriate and you give a score of 3. You ask this question, patient does not answer any of these questions, instead patient makes some sound. You give the score of 2, that is incomprehensible sound. If the patient does not answer any of the question, no response, then you will give a score of 1. Now coming to motor response. In motor response, you give a score of 6 if the patient able to follow any motor command. Example, you can tell the patient to lift the patient's arm or leg, or wiggle the patient's toes or fingers. If so, if the patient obeys these motor command, you give a score of 6. Now you give the score of 5, the patient able to localize pain. That means you apply pressure to the trapezius squeeze or to supraorbital pressure, and the patient brings the extremity towards the painful stimuli. That means patient able to locate the pain or localizes the painful stimuli, then you give a score of 5. Here you can see the patient lift his arm, crosses the midline and move towards the painful stimuli. You are applying pressure here, supraorbital pressure, and the patient extremity move towards the pressure area. So the patient is localizing or moving towards the painful stimuli, you give a score of 5. Now you give a score if the patient withdraws from the painful stimuli. That means patient moves away from the painful stimuli. So if you apply a central pressure, that means sternal rub or supraorbital pressure or trapezius squeeze, and the patient suddenly withdraws his extremities. So here you can see flexion of the extremities. That's normal. Or patient moves away from the painful stimuli. Here you can see pinching the nail bed and patient suddenly withdraws, moves away from the pain. Then you will give the score of 4. Now score of 3 is when the patient decorticate. It's called abnormal flexion. So you give a central pressure and you will see flexion of the arm at the elbow. And the arm moves towards the center of the body. So there is a flexion which is abnormal and this arm moves towards the center of the body. This is called decorticate posturing, and this is not a good sign because it indicates damage to the cortex of the brain. Now you give a score of 2 if the patient decerebrate. Decerebrate means the arm extends. You give the pain to the patient. Patient does not wake up. Instead, you will see the arm extends and internal rotation of the arm. So in this case, you give a score of 2, and this is the worst posturing. If to the painful stimuli, no response at all, patient does not have any response, patient is flaccid, no motor response, then you give a score of 1. And you add up all these 3 scores to a maximum of 15. That gives you a Glasgow Coma scale. Now let's see what are the factors that affect the Glasgow Coma scale. The factors are if the patient is intubated and sedated, patient may not be able to answer your question, patient may not be able to follow your commands. This can affect the Glasgow Coma scale. Hard of hearing, patient may not follow your commands, doesn't answer. If the patient has mental deficit or memory deficit, again patient may not follow or answer your questions appropriately. In those cases, you may have to make a special note. Patient intubated, sedated with eye opening, the score, verbal score and motor score. So today we learned about Glasgow Coma scale, and thanks for watching my video.